I was in Singapore taking my luggage off of a carousel and I ruptured a disc 4 weeks into a 5-week trip. And so the first surgery was not optional. I'd actually ruptured it and it had blown apart. So they picked the pieces out. Unfortunately, they didn't get them all. So mine was sudden. I had had no back problem, back pain until that point. I actually started the program in '92 or '93 and went through 3 phases of the program. Intensive rehab, where I started coming 3 times a week, then into strengthening of my back muscles, and then finally into once-a-month maintenance. And I have been a patient, if you will, continuously since that time. I had my first surgery in 1986, my second surgery in 1988, and was facing my 3rd surgery, which would have been fusion surgery, with limited chance of success in '93. I couldn't do hardly anything. I mean, I could hardly walk. I could hardly drive a car. I couldn't sleep at night. So, I mean, I used to golf a lot. Couldn't swing a golf club. I couldn't hunt and fish. Couldn't sit in a boat for any length of time because it was just too painful. So I basically had shut down most of my normal activities. A friend of my wife had an acquaintance who came to PNBC and had some success, and at the time I was facing my 3rd surgery, and my wife suggested I should at least try something before I have another surgery. So I came to PNBC, didn't have to have that 3rd surgery. I have to say my first impression is I was skeptical that it could help me, because I'd gone through all these other diagnoses and therapy and drugs and all of that, and nothing had helped. And I thought, well, here we go again. But so I was skeptical, and when I started, I could hardly walk through this door. I mean, that's how much pain I was in. And when I first started the program, the pain got worse. And more than once, I was ready to quit. I mean, I was saying, this isn't going to work. And Dr. Nelson and the therapist said, it's going to be tough for a while, but stick with it, because the alternative isn't very good. So I stuck with it with him, and finally, after about 2 months, I started to see some slight improvement, and just continued to improve after that. The way they described how this program works is what really sticks with me. What I was just mentioning to you, that there are no blood vessels. If you want to have a strong and healthy back, you've got to exercise these certain muscles that the machines behind me do. And once you get them to a certain strength and you keep that strength up, your back will continue to get better and be healthy. Come in, get an evaluation at PNBC, give it a try, and give it time to work. It may get worse at first, but you got to fight through that. So I'd say give it a try before you have surgery or any of the other invasive procedures that they have. I was really facing, like I said, a very limited lifestyle. And now I'm able to do, most everything I want to do. I'm a lifer, I can tell you that.